You're welcome to the Diabetes and Hypertension Intervention Program. This is Dr. Abimbola Hunifade, and I'm glad that you took the decision to watch this video. This is the introductory part, and this program promises to be highly impactful. The introductory part of the video of the program is free, at least as of now that I'm recording this, and it is loaded with great information that will transform your health, and you don't want to miss any part of it. Now, the common question when it comes to diabetes and hypertension that almost every patient used to have, and every patient will have at one point or the other, is number one, why does my blood sugar or blood pressure keep rising? The first question is, why am I not getting better? That explains number two and the number three questions. Now, why am I not getting better? When patients are diagnosed, they are placed on medication, and probably in the early stage you might not be placed on medication. You make some adjustments, and you discover that your parameters improved in diabetes or hypertension, but before you know it, despite the adjustments you are told to make, you eat your diet, you change your diet somehow, and you exercise more than you used to, you still discover that your blood sugar or blood pressure starts to rise. So that's when the second question comes in: why does my blood sugar or blood pressure keep rising even though I am on so many drugs? So to buttress the first question, that why am I not getting better, the patient first of all experience the problem, told to do this or do that. Then before the patient knows, the patient slips back, and the patient needs to be on medication. Then at the point the patient needs more medication, and at another point the patient then discover that despite the fact that he or she is on different medications, seems that is not getting better. So the patient begins to wonder, why does my blood sugar or blood pressure keep rising even though I am on so many drugs? Then that is the point at which the patient realizes that he needs to find a solution to this problem. And at this point, the patient is ready to find solution that is whatever it is, because it feels like the medical system has failed him or her. I'm not getting better. My blood pressure or my blood sugar keeps on rising. Anytime I go to the hospital, they say this, they say that, and they keep on trying this, they keep on trying that, from drugs to insulin to more insulin, and despite all of that, you still get abnormal value. What exactly is going on? Then the last question that intuitively everybody knows, you might not be asking this, but I want to let you know that this is a question you also need to ask, and that is, what is the danger ahead? Because if you are the type that is experiencing everything that I mentioned above, you're not getting better, your blood sugar and blood pressure keeps on fluctuating. Sometimes it seems that your medication works well. At some other time, it looks like you don't even know what you are experiencing. Then you need to know that there are dangers ahead. Now, the question, what can I do to save my condition? That you can save that condition. That is why we have put this program together. And in this program, we will answer all of these questions. Why you are not getting better, why your blood sugar or blood pressure keep rising, though you're on so many medication, what you can do to save your condition. That is the purpose of this program. And the danger ahead, I'll be talking about that as well. There are enormous danger ahead if you do not do what you need to do to save your condition, that I will be explaining to you in this program. Then this is a question that everybody have at the back of their mind. Once you are diagnosed of being diabetic or hypertensive or any disease that they have tagged that could not be cured, the next question is, there is something within you that doesn't agree with the verdict that have been given, and you begin to ask the question, can diabetes and hypertension be cured? And I'm sure you would like me to answer this question as well. The question that, can diabetes and hypertension be cured. Then I have some shortcuts for you. And number one, on diabetes, and regarding that question, that can diabetes and hypertension be cured? Actually, even in the medical cycle, even in the standard sense of it, diabetes is curable, and that is type 2 diabetes, I mean. Now, there are pros and cons to what I'm talking about. Sometimes they will say, okay, diabetes is curable if this and this is done. Type 2 diabetes specifically, I'll talk about type 1 diabetes at the end. Then they will give the conditions. But the way it seems is that we don't even seem to have any chance of saying this can actually be cured. This can be reversed. That's a more convenient word to use. But medically, it is recognized that diabetes can be cured through bariatric surgery and gastric banding. So, through surgery that is generally known as gastric bypass, diabetes, many people have experienced cure. This is not what somebody in a village is talking about. This is what is medically agreed and practically seen. Bariatric surgery is used to treat diabetes, and essentially the patient is not going to need medication again at the end of the day. So how does that happen? The size of the stomach, and it happens by reducing the size of the stomach and bypassing the upper part of the intestine, then connecting the lower part of the stomach to the newly formed small stomach. Don't worry about all of this stomach and how it operates. This is the operation it used to be thought of as being an anatomical intervention that gives a solution, but really it has been discovered that this solution is also physiologic, and in the sense that it helps in dealing with some hormones that adds to the problem, that not only adds, that even are main culprit in this problem. So in gastric banding, the size of the stomach is reduced using band. So if you ask that question, what is the answer now? Even in medical literature, this is agreed. I'm not saying that this is a claim that somebody just came out to make. This is a claim that any doctor will tell you, yes, that is done. Of course, this is usually used for patients that are obese, but nonetheless, there is a principle to it. Either the surgery is done or not, there is a principle to which it works, and that is one of the principles we'll be using on this program. But still on the question, can diabetes and hypertension be cured? What do you think now from the explanations that I've given you? So when a doctor looks at you and tells you forever, this is a life sentence, you have to be on drug forever and ever, what about these instances that I've cited for you? Why is it that there is a solution in that regard if you have to be on drugs forever? Then on hypertension as well, we have primary hypertension and secondary hypertension. In secondary hypertension, there is a known cause that is responsible, whereas in primary hypertension, there is no known cause. Actually, we say there is no known cause, but there are so many extensive research that have suggested what is causing this, and not only suggested, that are actually correct, because once the principles highlighted are applied, you discover that before you know it, patients begin to get off medications. So on hypertension, secondary hypertension, probably somebody has a thyroid problem that is the primary cause for the person becoming hypertensive. What happens when this underlying problem is fixed? The blood pressure returns to normal, and the patient does not need any medication for the blood pressure. It does not have any issue at all. That is seen in thyroid problems, that is seen in kidney problems, that is seen in pregnancy, problems like preeclampsia, eclampsia. Don't worry if you don't know what that means, but understand that that is seen in pregnancy as well. So that is in secondary hypertension. So once that is dealt with, the patient becomes, you don't need medication for hypertension. you become normal. Your blood pressure becomes normal. Then primary hypertension is responsible for 90 to 95% of the hypertension you will see in adults. So once you are not told that something is responsible for the hypertension, then you are in the primary category, and this is where almost everybody belongs. 90 to 95%, that is huge. So now in primary hypertension, that is what you are always told, that you have to be on medication for the rest of your life. There's not going to be a solution, and the rest, and that and that. But now, going by the explanation I've given you, can you say there is no cure or for hypertension? If secondary hypertension can be cured, then that means there is a cure for hypertension essentially. So we have made so many misleading statements that have put patients in the limbo. We've not been able to decipher and explain appropriately. But before you think that I'm just talking to those who have secondary hypertension, I'm saying again, can diabetes and hypertension be cured? Oh, yes, of course, from the explanations that I've given above. But now I have another news for you, and that is how to reverse diabetes and hypertension. Now, I want to discuss with you the solution to diabetes without surgery, as I've mentioned, and how to reverse hypertension, even if it is secondary hypertension that everyone thinks has no solution. Now, if there is half solution to a problem, it is an indication that there is a complete solution. There is no way there will be a solution to only secondary hypertension, and there would not be a solution to primary hypertension. And we quickly say we don't know what is causing primary hypertension, but really it has been discovered. So many things that are contributory and that are at the root have been discovered. And once you fix those things, it's just a matter of time. You begin to get off the medications gradually. You'll see that you improve, you have significant improvement, and before you know, you are off medication. I know so many people are going to be asking me the question, so if I do what you are talking about, am I going to stop my medication immediately? If I do what you will be talking about, what's going to happen, blah blah blah. Now, this is the principle. You don't stop your medications abruptly, and you don't even stop medication without the guidance of experienced doctor. You do that only as you are instructed. It's fine and okay for you to work with your doctor, because the essential thing is that even before your doctor's eye, he will see that you are recording parameters so normal that it might even be dangerous for you to be on the medication that you might have been. So they cut it. Before you know it, you do so well on that they begin to see that it might be too dangerous for you to still remain on the dose. Then they cut it again. Before you know it, they discover that, you don't even need it at all again. So that is the principle. The same thing for diabetes as well. You begin to experience improvement in such a way that your drug needs to be reduced until it is totally removed. Nobody just stops medication abruptly. If you are going to stop it abruptly, it must be at the direction of an experienced physician. And if you are thinking that, so where am I going to get any physician to help? Just don't worry about. We got your back. That's if you want our help. And if you just want somebody else to help you who is a physician as well, it's perfect. Now, there are the problem in diabetes and hypertension. We have two big culprits. One for diabetes and the other for hypertension. But both are equally present, especially in hypertension. The main culprit in diabetes is the problem of insulin resistance. Every doctor knows that. The main problem in hypertension is the problem of insulin resistance. Is the problem of inflammation. The second that have been discovered as well to be part of the problem is insulin resistance. Now, what is the problem when we talk about insulin resistance and diabetes? In diabetes, when you go on wrong diet for a long time, you're also physically inactive, you begin to gain so many weight, the cells of your body become filled up essentially with sugar. You have a sugar overload. That is the truth, and that is what is going on. Then as a result, there is need in the cells the sugar backs up in your blood, and it needs to be taken over. But your cells does not receive what it already have in overflowing. As a result, blood sugar keeps on rising. So the cells of the body has locked the door and they don't want to receive anything again. Why? It's because the cells of the body are now resistant to insulin. So you see insulin overproduction, excess insulin, then you now see insulin resistance. If you are going to deal with diabetes successfully, these two things that I've mentioned is actually the root that must be dealt with. And if you are going to do this successfully, you must do it through fixing the diet to be right and physical activity. You don't achieve this through any supplement. The best any supplement will do to you is for you to work. Herbal supplement now to work as your drug. It's not like, because even your drugs are made from herbs. The same way your drug will fail is the same way any herbal supplement, herbal concoction that they prescribe for you, the same way it will fail. And the herbal concoction or supplement you begin to prepare problem for your kidney. You don't need herbs or supplements to reverse diabetes. You don't need herbs or supplements to reverse hypertension. That is the truth. Now, in the culprit in hypertension, just like I said, inflammation. Inflammation is supposed to be a defense, because the body recognizes a problem. And as a result of that, so many things to explain. This is just an introduction. What happens as a result of the inflammation? Your blood pressure begins to back up. And that happens mainly due to food sensitivity. So, the two big factors, insulin resistance and inflammation. Other big factors, wrong diet and physical inactivity. Then when we fix this, we will fix the main problem. All of these that I've explained, especially insulin resistance, wrong diet, physical inactivity, very interrelated, and they cause weight gain. Even if the weight gain does not appear outside, all your organs can be packed full of fat, and that will affect your health significantly. So the solution lies in fixing that. So now, regarding how the gastric bypass works, because those are the principles we are going to employ. What happens is that there is a hormone in your intestine called gastric inhibitory polypeptide, GIP. When you eat, GIP sends signal to pancreas to increase insulin, which is the hormone that is bypassed in gastric bypass surgery that is used to cure diabetes. Now, the principle of this program that I bring to you for in terms of diabetes now is to fix this in the same way they used to do it when they do gastric bypass. Now, the only thing is that we are not using surgery to achieve this end, to achieve the result. We are going to be using the natural approach to it. And I'm going to explain more on that to you in the video on diabetes and hypertension antidote. So please don't miss it for anything. Now, this is our big picture, which is to get you off medication. And by that, we mean to keep your fasting blood sugar less than 100 milligram per dl. That corresponds to 5 millimole per liter. And your 2 hours postprandial less than 40 milligram per day, which corresponds to 7.8 millimole per liter. And your glycosylated hemoglobin between 4 to 5.6%. And to keep your blood pressure within normal parameter, we are going to talk about what normal parameter is later on. Then to keep blood cholesterol also within normal range. That's the big picture. So that's what we are working towards. The other goal is to prevent and deal with complications, to prevent chronic diseases. We want to help you being healthy with, and want to help you resolve the problem of food addiction. So a word on type 1 diabetes. Now, the problem in type 1 diabetes is different from type 2 diabetes. In type 1 diabetes, the beta cells of the pancreas have been destroyed because of an autoimmune response in which the body fights itself, thinking it's trying to defend itself. And as a result, insulin is not even produced. So type 1 diabetes will need insulin because it's not even produced in the first place. But there is good tidings ahead. Because of the present research that is going on that looks visible in the medical community. I'll talk more about that in Diabetes and Hypertension Antidote. But this program will help you as well. The way it will help you is that you will fix a lot of problems that I've been talking about as well. And as a result, you will need less and less insulin compared to what you need, and you will see improvement in your health more and more. For gestational diabetes, usually after delivery, it goes away. But this program will help you as well during the time when you are pregnant if you have gestational diabetes. Gestational diabetes is determined in the sense that the person would not have been diabetic before prior to being pregnant. So that's gestational diabetes. You are diagnosed during pregnancy. So this program will help as well. We have a way of fixing the peculiarity of type 1 diabetes and gestational diabetes in this program. And then you don't joke with gestational diabetes, because most of the times over some years after, people with gestational diabetes at one point or other ends up getting type 2 diabetes. So this is the time to fix that as well. So please, if you are watching this on YouTube, I would like you to subscribe. Just click on the subscribe button, like this video if you like it, please. Then click the notification bell. Then there is an arrow that points down if you are watching on your phone. Please click that arrow. I'll be leaving more information to get how you can get other videos that relates to this program there. And subscribe. I've said that. You can leave a comment for us, please. If you want to be part of our WhatsApp group, you can go to www.smartmedicalprograms.com/WhatsApp. Then I'll leave the link for you to join our Facebook group down as well. So look at it and do all of that. Thank you for taking our time to listen to this. I can assure you, you're on your way back to your health. I'll see you in the next lesson. Thank you.